Welcome to MedTalks, your go-to source for health information and medical insights. I'm your host, Juvenava, and we are bringing you the latest in healthcare. Whether you're looking to understand the basics of wellness, gain practical tips for everyday health, or learn about community resources available to help you live a healthier and happier life, MedTalks has you covered. Join us on this journey to better health, and remember, a healthier you starts with a single conversation. Stay informed, stay healthy with MedTalks, where every talk is a step towards a better you.
This Thanksgiving morning, before the turkey and pumpkin pie, join us for a tradition that gives back. GraceMed's Say Grace 5K race. Walk, jog, or run with friends and family through Midtown Wichita, all while supporting GraceMed Health Clinic, bringing affordable care to those who need it most. Start your holiday with gratitude, community, and a little exercise so you can enjoy that second slice of pie guilt-free. Register today for the Say Grace 5K presented by Strive Bank. Visit saygracerace.com.
Welcome, guys, to another episode of MedTalks. I am Juvenava, Director of Community Outreach and Communications at GraceMed. We are still on the road. We are in Topeka at our Capital Family Clinic. I am here with Abby. Abby works at GraceMed. Abby, talk to us a little bit about what you do, your title, and what's your responsibilities at GraceMed for our listeners?
Right. So as Juven said, as you said, my name's Abby. I do the Pregnancy Maintenance Initiative program here at GraceMed. Mm-hmm. So it's basically like a case management position where when pregnant women come in to get prenatal care, I just make sure they're being transferred or referred out to the different community resources and services that we have throughout the community.
Okay, that's awesome.
Yeah.
So talk to us about, like, if a patient comes in, is needing services, what is a day with you, or what does a session look like with you, like an appointment session?
Right. So the first session that we like to get all of those intro questionnaires and everything like that done. So we do social determinants of health screen just to make sure, how's your housing situation going on? How's your bills? Are you able to pay for your bills?
Yeah.
Food? We want to make sure that all those social determinants are being taken care of, or if there's anything you need help with.
Okay.
And then we also do depression screenings, things like that. So
Nice.
It's very much tailored to the individual themselves.
Okay. How do they get referred to your program?
So a lot of people don't know about all the other programs that they're able to access throughout the community here.
Yeah.
So all they have to do, if I notice that maybe they need help with rental assistance or food assistance, I show them the programs that we have throughout the community here, and then ask them if they'd like to be referred, and then I have the information that needs sent to the place of referral.
Nice.
Yeah.
Do they have to be a GraceMed patient to receive these services?
They do not. Anybody, as long as you reside in Shawnee County, you
Okay.
do not have to be a patient at GraceMed. And there's several clients now that is the case. We get clients that'll just walk in off the street. Hey, I saw a brochure for the program. I'd like to learn some more information about it.
That's awesome.
Yeah.
Abby, what made you decide to want to be a part of this program? Because you have to have some kind of heart for this, right?
Right.
What made you make that decision?
Just knowing the struggles that some of the pregnant women face out there. Like, they're a population that, you know that someone's pregnant, and then when a mom's pregnant, everybody wants to focus on the baby or after the mom has the baby, but nobody wants to focus on the mom as much as the baby. So that's kind of where I come in and thought to myself, well, this is great because then all these other people want to take care of baby, but who's taking care of mom and who's making sure mom's okay and that mom's in a good, safe environment and that she's being taken care of.
Yeah, because I think moms sometimes just worry about their pregnancy and their baby and sometimes forget about themselves.
Right.
And so these resources are great for them to have access to so that they know they can have a healthy pregnancy.
Right, exactly.
Yeah. What is the mission of this program?
So basically just to help women have the safest pregnancy that they can have and get through every stage of pregnancy, every trimester, and then up until after they have their baby. Because I can see the patients 6 months after the birth of the baby.
Okay.
So it's just making sure you have the best, healthiest outcome possible for the mom.
Well, you answered my question because I was going to ask you, can they still receive services like post-pregnancy?
Absolutely.
Okay. And what does those services look like once you deliver the child?
So we make sure that if you have not set up a pediatrician appointment for your baby, we go over the different pediatricians that are around the area that you would like to go to.
Yeah.
We make sure that your maternal health postpartum is okay, because there's a lot of hormones that go along with having a baby, and some of those can last a year up to after having the baby.
Yeah.
So we make sure that mom's mood is okay, that if she's breastfeeding, we make sure she's getting into the breastfeeding clinic, make sure she's getting that well woman exam and postpartum visit. So it's really there for mom to make sure mom is getting the care and the health care that she needs.
Okay. Without sharing any personal patient information, because we don't want any HIPAA violations.
Right.
Has there been, is there a story that you could share about the impact that you've had, or that the program has had with a mom?
Yeah, absolutely. So we've had patients that have moved from different states like Florida, Texas, and one in particular, she moved here and she didn't know anybody. It was her and her significant other. They moved here. They didn't know what to do. They didn't know where to start. No insurance, no nothing. And GraceMed as a whole just works so great for the community. They were able to come in here. I was able to get her set up for a prenatal appointment. We were able to get her situated with insurance through our health navigators, and then tell her about the community, help her learn the different places that she would be able to rent from and what the cost of all of that looked like. And then she ended up having the best outcome.
That's awesome.
Yep. They're
That's
doing
incredible.
great. Yeah.
Well, that also speaks volumes of the work that you do, because you have to build relationships with our patients, right? There has to be like a trust there.
Right.
And so it's very important. If there's anyone out there who wants to participate or be part of the program, where do they go? How can they sign up? What does that process look like?
They can either call me, my phone number, my direct line, 785-478-5905, or just walk into the clinic, just walk into the Huntoon clinic and tell the PSRs at the front desk that you'd like to talk to Abby about the PMI program.
Awesome.
Yeah.
Well, Abby, thank you so much for joining us. It was good talking to you.
Yeah, thanks,
I know I see you like randomly here now, so it's great to be able to like talk to you and like really connect with you.
Thanks for having me.
Yeah, thank you for all the work that you're doing.
Absolutely.
Yes. Thank you guys for listening to another episode here on MedTalks. We will see you next time.